Mr. President?
Senator from Pennsylvania.
Mr. President, I'd ask that the quorum call be vitiated.
Without objection.
Thank you, Mr. President. I rise tonight to talk about a couple of issues I know that we'll be considering, at least I hope all will be considered in the negotiations that are underway. I know later in this hour we'll be joined by three of my colleagues, Senator Whitehouse, Senator Blumenthal, and Senator Duckworth. Each of us will be talking about these issues from a different perspective, but all focused on those in our society who are most at risk in the midst of this worldwide pandemic, in the midst of this economic and jobs crisis that we're confronting right now. We know that this is the most difficult public health crisis in a century, and one of, if not in the top two job crises we've ever faced. And when we talk about Americans who are most at risk, among them are, of course, older Americans. Tonight I'll spend some time talking about older Americans in nursing homes who are at risk if we don't take action. People with disabilities who need the benefit of, as do many older Americans, need the benefit of home and community-based services. Third, Americans who are in communities of color, who need the benefit of Medicaid, among other programs that we should be focused on. Let me start with nursing homes. We know that in the context of nursing homes, the care that's provided there is the highest level of care for an older American or sometimes a person with a disability, and that's skilled care. We also know that that's care that's provided to men and women who have done so much for the country. Americans who have fought our wars, worked in our factories, built the middle class, built America in so many ways and gave us life and love. And all that they ask and all that their families ask is when they're in a long-term care facility, especially a nursing home, and that they're receiving skilled care, that it's quality care, and that in the midst of this crisis, that we're taking every step possible to protect them from the virus and to keep them safe. Unfortunately, that hasn't happened in America today. As we speak tonight, more than, and just a couple of days ago, the number was lower than this, but now it's more than 62,000 Americans have died in long-term care settings, most of those in nursing homes. When you add up the residents who have died, contracted the virus and died, with the workers who have died, more than 62,000 Americans. That's about 40% of all the deaths in America. We have to take steps to get those numbers down, both the death number as well as the case number. And of course, the two are directly related. A number of months ago now, Senator Whitehouse and I, and he joins us on the floor tonight, introduced Senate Bill 3768, which was the Nursing Home Protection and Prevention Act, which was a $20 billion proposed $20 billion investment in best practices. The tragedy here is that we know what works to get the death number down in nursing homes. We know exactly what works. And those nursing homes that were implementing these best practices months ago, way back sometimes in early March or even in February, are the ones who had lower numbers, fortunately, of deaths and case numbers. We know that you have to invest in a series of best practices. That means having enough personal protective equipment for everyone in a nursing home, but especially the residents and workers. We know that that is essential to keeping people safe. We know that testing is part of that, of course, and having the capacity to test frequently, and to have results transmitted very quickly. We know that cohorting, and it's not a term that we hear a lot about, but it's a very simple concept. Cohorting means you separate the residents with COVID-19 from those that don't have it. And as easy as that is to say, it is more difficult to institute in a nursing home. Sometimes you have to retrofit. Sometimes you have to take other steps that funding is needed for. But cohorting works. It stands to reason, but we know it works now that we have some experience with the virus. We know that surge teams are critically important as well as part of these best practices. If you have an outbreak in a nursing home, we've had so many examples of that in my home state of Pennsylvania and so many other states. When that happens, when the virus is spreading and there's a crisis in that nursing home because of the virus, you might need more help. You may need more doctors or nurses or certified nurses assistants or so many other critical personnel in that nursing home. So $20 billion is a good down payment on protecting Americans in nursing homes. So our bill would do that, and I'm grateful for the help of Senator Whitehouse as well as so many other members of the Senate who joined in that bill. Unfortunately, the bill proposed, I guess it was July 27th, some of the last days of July, the bill proposed by the majority has no meaningful investment in these best practices. And we have to ask ourselves, I guess, is this what America is going to settle for? The greatest country in the history of the world is just going to throw up our hands and say there's really nothing we can do. It's a pernicious virus, and the virus is spreading in settings, in congregate care settings like nursing homes, and you have individuals who are particularly vulnerable, so there's not much we can do. That is a defeatist, anti-American attitude. We know we can get these numbers down if we make the investment. The America that we claim to be would have a full-court press, a pull-out all the stops effort to make sure that we get these numbers down. So I don't think most Americans believe that we should throw up our hands and surrender to another 62,000 plus deaths a couple of months from now, which is where we could be headed if we don't take these steps. Now, no one would assert that we can get these numbers down to zero, or there's some magic wand that will allow us to remove this threat from those we love so much in these nursing homes. But my God, in America, we're not going to take steps that we know will work to get the case number down and the death number down. I think America's ready for an action plan that has been developed here in the United States by smart people who know how to attack this problem. So that's issue number one among the most at-risk Americans.